Tonight at 6, there is a new sign in Bartholomew County calling attention to an issue already plaguing rural hospitals across our state that may get worse.
The Democratic National Committee is now hoping the message on the board will draw more attention to the issue that is impacting thousands of people that make their home here in the state of Indiana. Emily Longnecker is here to explain. Emily.
Yeah, the billboard was paid for by the DNC and blames President Trump for recent cuts at Columbus Regional Health. In a county that voted overwhelmingly 60% to elect the president, this billboard near Columbus Regional Health has a message for those voters.
I think it's really important that we tell people, it's okay if you voted for Donald Trump, but we want to point out that you voted for Donald Trump, you didn't vote for this, and we know that, and you didn't vote to have your services cut.
Democrats are talking about what they say will be the negative impact on rural health care, with the president's tax and spending cuts bill becoming law. Last month, even before the new law, the Columbus, Indiana hospital announced it was cutting some services like its inpatient rehab unit, outpatient orthopedics, and their athletic trainer program. The hospital cited what it called, quote, unprecedented challenges and financial hardships experienced by health systems across the country, noting rising supply costs, legislative scrutiny, and federal and state funding cuts. This week, in a statement, the hospital said it didn't have advance notice of the billboard going up or that its recent cuts would be referenced. The statement went on to say in part, quote, the potential of large cuts to vital governmental payer programs like Medicaid pose catastrophic and potentially irreversible repercussions to providers like Columbus Regional Health to deliver the services our community needs. In Bartholomew County, more than 19,000 people are on Medicaid, according to the state's Medicaid enrollment dashboard. That's 1/4 of Bartholomew County's population. Community advocates say under the new law, there's a greater risk of people getting kicked off Medicaid because of more frequent work reporting requirements that could lead to paperwork errors.
Those folks still have bodies, they still can get sick, right? The cost of their care is then going to get passed on and be uncompensated to local providers. And that is potentially and likely not economically sustainable.
The new law includes a $50 billion rural hospital fund to help, but how that will get dispersed is still unclear.
It's, better than nothing, I suppose, but it is a temporary, source of funding and revenue within the context of colossal changes.
On Thursday, Governor Braun blamed a broken system as the reason rural hospitals are struggling.
We got 80 to 90 rural hospitals hanging on by their fingernails. You got 5 to 7 very rich systems. And if you run like an unregulated utility, something's going to have to be done to make sure we have good care and access in the rural community. And part of that responsibility is going to have to be on the shoulders of the rich hospital systems.
According to the Indiana Hospital Association, right now, 27% of the state's rural hospitals are operating at a loss. And the Indiana Hospital Association issued a statement calling the recent cuts to Medicaid drastic, saying they will only exacerbate the financial strain felt by hospitals across the state, including the ones that serve rural communities. At the Indiana State House, Emily Longnecker, 13 News.
Thank you, Emily. Some economists estimate that 12 hospitals in Indiana right now could be at risk for closure in some of the rural areas. Those are areas where residents are underserved and they rely heavily on Medicaid. Columbus Regional Hospital is not on that list.